Sarcoidosis has been called the great imitator. It can hit the lungs, the skin, the eyes, the heart, even the brain, and it rarely announces itself the same way twice. For a nurse practitioner, the challenge isn't finding sarcoidosis in a textbook list. It's recognizing the pattern in front of you. At its core, sarcoidosis is an abnormal immune response. T cells and macrophoges clump together into tight little balls of inflammation called noncaseating granulomas. Unlike tuberculosis, there's no central death of tissue. That distinction matters enormously once we get to diagnosis. 90% of patients have lung involvement. It's the single most common presentation and often the first clue. Patients report a dry cough, shortness of breath, sometimes just fatigue, vague enough to be missed for months. Skin and eye findings are the ones you can actually see in clinic, and they're often what brings the patient in. Lupus pernio, this dusky plaque across the nose and cheeks, is one of the most specific skin findings we have. And uveitis lamation inside the eye can threaten vision if it's missed, which is why any sarcoidosis workup includes an eye exam. Cardiac and neurologic sarcoidosis are rare, but they're the forms that kill quietly because symptoms are sitting on the conduction system, can cause heart block, arrhythmia, and symptom even deserve real day attend. In the nervous system, fasciosis, dressed up as something far more common. Not every presentation is subtle. Lofgren syndrome is announcing itself clearly, and it's worth nodosum, joint pain, usually the ankles, and Bilateral on imaging. This triumph has an excellent prognosis, often resolving on its own. So how do you actually diagnose sarcoidosis? Think of it as a three-legged stool. You need all three to stand on solid ground. Tissue confirmation usually comes from the easiest, safest spike, often an endobronchial ultron-guided biopsy of those helical lymph nodes. And you must rule out the imposters, tuberculous infectomoma, because treating sarcoidosis with steroids when it's actually an infection can be dangerous.
Fan that Sarcoidosis with exserum ace antibiotic shortening involvement and CT chest pulling ID stack lyop tests. Their juice storvid this forest confirm F ruling out the mimic. Think multisystem confirming out the mimics. They tell a clear stories.